Hello, my name is Stuart Lawrence and I'm the Clinical Director of the Spinal and Natural Healthcare Centre in Benfleet. The centre is dedicated to health and wellness and it empowers people to take control of their lives through spinal care, nutrition and exercise. Back in 1999, I became progressively more involved in the wellness side of my practice. I had found so many families suffering from chronic symptoms and conditions that were remaining totally unresolved. I discovered that many people were trying to handle these chronic issues by using short-term relief methods whilst the underlying cause was being totally overlooked. Talking with these people, I found they were unaware they were simply settling for quick and temporary relief whilst totally ignoring the deeper underlying problem. They had missed the key component that would allow them to gain long-term results through proper repair and healing. The fact that the body was designed to be self-sufficient. From the moment we are conceived, our body is self-sustaining. It is designed to be self-reliant and self-sufficient. We grow from 1 cell to 2, from 2 cells to 4, from 4 to 8, and all the way through to our birth. We're evolving and adapting to the stresses placed upon us. Even after we are born, our body is still regulating itself. It monitors each activity, our heart, lungs, kidneys, each and every system to keep our body functioning in the way it was designed to function. In fact, the definition of health could be the way the body is able to adapt to the stresses placed upon it. Even when we were not tall enough or strong enough to open the refrigerator or feed ourselves, we understood that if we skinned our knees or coughed due to an allergy, that our body was aware of a problem. It was aware that in some way we needed to heal our injury or soothe our discomfort. And it is this innate ability to self-heal that is the natural way for our body to function. The only time we aren't able to take care of ourselves is when our bodies become overwhelmed by emotional, chemical or physical stresses. These underlying stresses are called barriers to healing, and they are the keystone to both sickness and health. The fact is that there are 3 types of stress which can affect us: emotional, chemical or physical, and these are basically either structural or postural. When our natural adaptability is confronted by a barrier to proper functioning, such as an emotional crisis, we tax our resources of stress handling. Our kidneys work harder, our thyroid works harder, our livers work harder, and our heart works harder, and our entire body upregulates to handle the crisis. If we are confronted with a chemical stress, such as a poison, then the same thing occurs. So this barrier can be an immediate crisis like an infection, or it can be a slow developing crisis, such as being consistently under stress over a long period of time. Someone may have been under stress for a day or 2, or have they been under stress for a month or 2? How about a year or 2? And the thing is, all of this adds up. Structural stresses can cause inflammation that result in pain, and it is amongst these stresses where the most common symptom patterns are found. We all feel achy after sitting in a chair for hours without moving. That's only natural. However, after a stretch and moving about for a while, we should feel better. But what if our body still aches? If this is the case, then it is most probably due to inflammation caused by structural stresses in the body. It is important that we understand these signs because they show us where and how chronic conditions develop. A small stress can, over time, create a detrimental change within the body, and such changes can often create a situation of chronic inflammation, which eventually results in pain. There is only one way to restore the body to a healthy state, and that is by quite simply identifying the underlying barriers to healing. It is these barriers to proper function that need to be removed, allowing the body to work in the way it was designed to work. Let me explain what you will feel, what we look for, and how we go about doing this. The structure of our body is a complex puzzle of bones, held together by muscles and ligaments. We are designed to be highly flexible and mobile, but still protective of our vital organs and the systems that depend upon them. Our body is what the profession defines as an open kinetic chain. This means that when we stand up, we are connected at one end to where our feet touch the floor, whilst the other end, our head, is free and open in space. A closed kinetic chain is like a bicycle chain. It's a loop where everything is connected. So basically we function from a point of stability where we are connected from the ground upwards. Well, as the old song goes, the foot bone connected to the ankle bone's connected to the... you get my drift. So, whenever there is a problem in the kinetic chain, we have to address not only that problem, but also everything below it to ensure the kinetic chain is performing and 100% operational. Whenever a bone moves out of alignment, it creates a stress on the system, and this is called a subluxation. Initially, there can be one, which in turn creates another abnormal motion, which creates another and another, much like a row of falling dominoes. This stress triggers inflammation, which is designed to let you know to be careful because that something is wrong. With the inflammation comes the sending of pain signals, so you can't miss the fact that something is wrong. This pain continues until the body feels there is nothing left to worry about and allows the body to clear the inflammation, thus ending the pain signals. This is why when people use aspirin or ibuprofen, it lowers the inflammation, allowing the pain to pass, but it ignores the reason the inflammation started in the first place. The inflammation is still there and ultimately the pain comes back. It is a stressful cycle that is best avoided by finding the underlying barrier to function, or the original subluxation. If this misalignment happens in the spinal column, the bones that protect your central nervous system, it can cause inflammation that creates stress on the nerves that carry information from the brain to the organs, muscles, and the cells of the body. This can create pain far away from the actual injury, and it can cause muscle spasms, leg or arm pains, twitches, and an overall decrease in the body function. Because the nerves that are affected by the inflammation travel from the brain to every area of the body, these subluxations can create problems and symptom patterns in any area of the body. These include headaches, back pain, and even digestive or hormone issues. Literally, the list just goes on and on. So, bones are dynamic and change according to stress, as in the same way do ligaments and muscles. If we work out and thereby put stress on our muscles, they grow to adapt to the stress. If we have inflammation in a joint for a period of time, the joint swells and the bones change to adapt to the stress, and this, believe it or not, is called arthritis. It is literally your body trying to adapt to a postural or structural stress. So, now that you understand how these things happen to you, are you ready to find out what can be done about it? Understanding that the body is a constantly adapting mechanism, and knowing that all pain is due to inflammation, and knowing that your body is attempting to handle a crisis, prompts me to ask you this question. If you're unable to fall asleep or wake up refreshed, if you're suffering from migraines that make your eyes hurt, if you're suffering from nagging low back or shoulder tension, is the logical way to deal with this simply to take a pill that numbs you to the pain? Now, I would suggest that the answer to these questions should be a resounding no. Will it not be smarter to look for the underlying cause, i.e. the reason it's actually happening? Will the next move then be to fix that barrier so that the body goes back to functioning normally? And I think we can all agree that the answer is literally a resounding yes. The only way to feel well for a long period of time is to find and remove the barriers to healing. So, now that I've explained the reason these symptoms developed, let me tell you what can be done to lessen and hopefully eliminate them. The first step is to take a look at the functioning systems of the body. I look at my client's structural and nutritional components prior to deciding how to move forwards. One thing which makes the way we work at Spinal and Natural so different is that we take all the time necessary to understand the barriers to the function we are dealing with. This understanding is clearly established before we move forward to any treatment care plan, and I believe this is the reason that we get such great results. This method of diagnosis is designed to ensure that you get the best results possible from your treatment. Treatment that is specifically designed to help you feel better fast, and one that gives you the long-lasting results. Once we locate the underlying barrier to function, then we design a program specifically for you. If it's a chemical or an emotional stress, we need to identify the nutrition necessary to support the body function. If it is a structural stress, we need to locate the underlying misalignments in the kinetic chain, and that is essentially what I do, how I do it, and how we get such great results. So, if you feel you or anyone you know could benefit from the care we provide and would like to book in for a consultation, then please call the centre on 01268 752 123. Alternatively, if you require more information, then please take the time to log into our members section. I hope you found this information of interest, and if you need us, we are here to help. Thank you very much.